Okay, today I am assessing my patient. I'm going to assess her lungs, thorax, and her cardiovascular and peripheral vascular system. First, I'm going to just take an overall look. Notice that she doesn't have any nasal flaring when she's breathing. Her posture is appropriate. Her face and lips are without any discoloration other than the slight rosacea on the cheeks, which we've spoken about in the past. There's a history of rosacea. She's aware of that, and it's completely benign finding. So I'm also noting that her facial expression is relaxed. There's no apparent distress. And now watching her breathe, there's no use of accessory muscles, breaths are calm and even, and there appears to be no retractions. Chest expansion is symmetrical while she's breathing. And we'll go ahead and see how she's sounding. So that was a little trick. I wasn't actually listening to anything. I was just seeing how many breaths you were taking per minute. So you're breathing at about 16 breaths per minute. I didn't want to let you know beforehand because I didn't want to have you focus on your breathing, because that can really make a difference in the counting. It causes you to want to breathe more or less when you're focusing on that. So breathing relaxed, calm, 16 breaths per minute. Now I'm going to just assess the sternum is midline and right here in the center. Chest wall is appropriately shaped. I'll take a look from behind. Chest wall is appropriately shaped. Let me see, ribs. Ribs are not visible, but I can palpate that ribs are at a 45-degree angle. And let's see here. Is there any tenderness? No, no tenderness. I don't feel any masses, and I will check the shape of the ribs here. No masses, no lesions on the anterior or posterior chest are noted. And there's no tenderness anywhere that I was palpating. No tenderness, nothing hurts in there. Okay. Now I'm going to check for fremitus. I'm going to place my hands on you and have you say 99. And what I'm doing is I'm feeling for the vibration when you say that. Each time you feel my hands come down, say 99.
99,
Okay.
99,
Louder.
99, 99, 99.
Okay. We'll do that back here as well. It's kind of neat. I actually really can feel those vibrations.
99, 99,
Okay, and this is, go ahead.
99,
Okay. Normal fremitus. Everything feels good there. Chest expansion appears normal posteriorly back here and anteriorly. I'm going to place my hands on your chest just below here, and I'd like you to go ahead and take a deep breath. Let that out. Okay, chest expansion is normal, and I'll do that from behind as well. There's a wall right there. If you could turn just a little bit. Okay. All right, go ahead and take a deep breath. Okay, chest expansion is also normal behind. And I forgot to note that prior to the assessment, I did wash my hands and warm them. So we're good there. Okay, I'm going to do what's called percussion. So I'm going to be listening to the sounds of your chest as I tap on my fingers. I hear dullness over the liver. And I'm taking care not to do percussion over the scapula. I hear resonance over the lungs. Let's go up here. Okay, so tones all appear normal when percussing the lungs. I'm now going to auscultate the lung sounds. Take a deep breath each time you feel the stethoscope touch you. Sorry. Okay, let's try that again. And now I'll listen on the back for the lung sounds to the base of the lungs. I'm going to put my hand here on your back. Okay, deep breath. Okay. Now I'm going to listen with the other side of the stethoscope. Go ahead, deep breath. Okay, lung sounds are clear. Next, I'm going to assess the neck vessels. I'm going to palpate the carotid arteries. I'm going to palpate these separately. Carotid pulse is strong, 2+. I'm going to listen to the carotid arteries. And if you could just hold your breath. Okay, no bruits, no murmurs heard in the carotid, no thrills either. I'm going to listen to the different sounds of your heart now. I'm going to listen to the different spots on your heart. I'm going to listen to your apical heart down here. Okay, apical heart rate is 76. Everything sounds really good. No, I auscultated heart sounds S1 and S2 and heard no murmurs or extra sounds. Now I'm going to take a look at the arms and note that there are no lesions. I'm going to take the radial pulse. Okay, so I will complete my assessment on the arms. I note that there are no lesions, and I've taken the radial pulse. Radial pulse is 3+ and strong bilaterally. I'm going to check for any clubbing. There's no clubbing. The shape of the nails is within normal limits. Cute nail polish. Sparkles. I'm now going to check for what's called capillary refill, where I'm just going to press down on your fingers, and I'm noting that capillary refill is less than 3 seconds, so that's great. Do you have any problems with varicose veins anywhere on your legs?
No.
Okay. Do you mind if I take a look at your feet? I'm just going to note if there is any edema, and I would like to also do capillary refill test on your toes. So I'm not sure if this is coming up in the video, but okay. So we can't see the toes in the video, but I'm assessing the toes. There are no varicose veins noted here. There is no edema, and capillary refill in the toes is less than 3 seconds. No lesions noted. Any tenderness or any pain anywhere in the feet or legs?
No.
Okay. All right. So that completes the assessment of the lungs, thorax, cardiovascular, and peripheral vascular system. Thank you.